consequential time until we did the right thing for our country.
You're right.
Now I want to tell you, enough about that. Read the book. I hope you do. I hope you enjoy it. I hope you recommend it to your friends. You can buy it at $16.20 on Amazon.com or at your local bookseller. I don't care how cheap you buy it. You don't have to buy the $30 volume. I get paid the same amount regardless. I want to talk, though, about for a couple of seconds and then answer Duck a couple of questions. I want to talk about last night. Now, look, I'm spun up about this bill. Big time. I'm spun up about this bill. Big time. It is bad for the country.
It is.
It's bad for our health system. It's bad for healthcare professionals. It's bad for people who need help from our healthcare system. And if we allow it to go fully into force, it will bankrupt our country. Yeah. No ifs, ands, or buts. It is built on the kind of accounting that we sent Bernie Madoff to jail for. And it was stuffed with bribes and special privileges and insider deals that just simply have no place in American politics. That's the bad news. The good news is we got time to stop it. Yeah. We got time to stop it. Every Republican candidate for senator or Congress this year has got to pledge that their first order of business when we take control of the Congress will be to repeal, reform, and replace this bill. I mean, I want you to think about this. Look, I'm from Texas. You know we Texans, we're not all that bright. We kept being told this is to solve the problem facing 46 million uninsured Americans. Well, 9.7 million of those people are legal or illegal aliens. Now, I'm pro-immigration, but the American taxpayer should not be picking up the cost for health care for people who are here and are not U.S. citizens. We just shouldn't. There are 18 million people. There are 18 million people in that number who make $50,000 or more a year. Many of them are young and think they're bulletproof. I wish they had insurance. You know, if they get sick or have an accident, I bet they hope they had insurance. But look, we're still America, a nation of freedom and personal responsibility, and the taxpayer should not be picking up the tab for people who make that much money for all their health care. Now, we got 14 million people out of that uninsured who are already eligible for Medicaid, Medicare, S-CHIP, TRAMPUS, TRICARE, Indian health care, veterans, or some other form of government-provided health care. And the government has done such a lousy job of signing those people up that we're what? Going to create another government program? Now look, you take 46 minus 18 minus 10 minus 14, and you're left down there in the 5 million range. And I tell you, I'm worried about that 5 million. I don't want to deprecate the problems they face. But think who they are. They're working. They make too much for Medicaid. And they don't get coverage from their insurance, from their employer. Maybe we ought to focus on solving